Hi, I'm Delusion Dispeller. Welcome back to Borderline Personality Disorder in bite-sized pieces. I'm going to talk to you a little bit today about the causes of borderline personality disorder and some of the treatments for borderline personality disorder. It kind of opened my eyes reading this because I didn't know some of this information myself till I learned it today. So I'm going to share it with you now. So there's not just one cause for borderline personality disorder. It's not justified by research by the time of the publishing of this book that borderline personality disorder, or BPD, is a direct result of childhood abuse, neglect, or mistreatment. In other words, it isn't always caused by that. What is seen in the person who had BPD is that the disorder was triggered into action due to different factors, like poor parenting due to mental illness or addiction, possibly an unsafe home environment, a clash between the personality of the parent and the child, a loss of a parent, or a birth of a new baby, or even a death in a family or a death of a friend. Risk factors that increase the chance that a person has BPD are both biological and environmental. If a child has problems in their neurotransmitters, which controls reasoning, acting on impulse, and balanced emotions, plus they're being raised by narcissistic or abusive people, BPD is possible to occur. One of the things that we try to establish with therapy concerning a borderline personality is radical acceptance and mindfulness, and also being present in the moment, among other things. So there's a couple different exercises I wanted to explain to you that are used with people that have BPD to help them feel more grounded and be able to handle life a little bit better. So one of them goes like this. You set a 3-minute timer. Pick an object that you have no feelings towards or about. Use all your senses to explore that object. Smell it, see it, observe it from all different angles. If your mind starts to wander, move your mind back to focus on that object again. Do this for those 3 minutes to embrace being present in the moment, or mindfulness. It's crucial that you don't make judgments about that object or about yourself, but that you just embrace and feel the moment fully without self-criticism or criticism of others. When a person with borderline personality disorder is able to learn how to be present in this way, it helps with the confusion and unpredictable behaviors for that person. This will help them not stir up turmoil in their relationships and life. Although it will not necessarily guarantee a life without struggle, it will help the person with BPD be better at problem solving. Something else called thought embrace, at least that's what I named it. You set your timer for 5 minutes. Start thinking thoughts, or not purposely focusing on thoughts, but let the thoughts just come and go in your mind. Don't try to push them away or control them or hold on to them. Let them do what they do. Over time, this will help the person with borderline personality disorder not obsess or worry over a thought. It can also help the person with BPD to focus on completing tasks. Now, this is interesting to me because I didn't know about this next type of therapy. You've heard me talk about DBT. There's DBT. There's also, I'm trying to think, schema therapy, which is another therapy that deals with people with borderline personality disorder. There's also MBT, which is called mentalization-based therapy. Mentalization-based therapy, or MBT, focuses on the client-therapist relationship and other relationships that the borderline has. It also focuses on helping them maintain emotional control over themselves, rather than being so much about dysfunctional behavior as like DBT does. Determining which thoughts are the borderline's thoughts and which are other people's thoughts is a big part of MBT. Understanding how the thoughts and behaviors and feelings and wishes and hopes and dreams and goals and all those things actually influence the behavior of a borderline and anybody else. That's important in MBT. Medications are sometimes helpful, such as antidepressants, antipsychotics, mood stabilizers. In some cases, psychotherapy is also used. The part of the brain known as the amygdala is what is directly affected in a person with BPD. And what they have found on studies and brain scans is that it is way more active in a person with BPD than the neurotypical non-BPD person. Some specialists believe that the BPD traits can be passed on by parents who have this and other disorders such as substance abuse disorder, bipolar disorder, or PTSD even. So it's kind of interesting information to note that, number one, BPD is not always caused by abuse in childhood or neglect in childhood, or even turning a kid into the star child or golden child in the family, which I did not know that. I didn't realize that. I thought it always was caused by those things. Apparently not. So I stand corrected. I can make mistakes, definitely. So basically, BPD, they're really not sure exactly what causes it. There are links between abuse in families and neglect in families and even overly praising a child. There are links to that. But what they're thinking now is that, or at least when this thing was written, this book, Stop Walking on Eggshells by Randy Krieger, what they think now is that the child already was predisposed in some way to have this overactive amygdala or something going on in the neurotransmitters in their brain. And when they were brought up in this environment of parents that were overly permissive or overly punishing, this triggered that amygdala response and kicked into gear the BPD behaviors that we see so commonly now. The I hate you, don't leave me, the clinging to people, the bait and switch behaviors, the I adore you, I hate you, idealization, devaluing, black and white thinking, you're all good, you're all bad. All that stuff was apparently triggered by the chaotic home environment or some other traumatic thing in life. That's what they're linking it to now. Rather than just saying a blanket statement of, well, you were abused, no wonder you act like that, you must have BPD. So, anyways, of course, BPD can only be diagnosed by a qualified psychiatrist, which I am not. I do not diagnose it. However, I can diagnose because I do have psychology degrees. I would never diagnose anybody online. That's just plain stupidity. You cannot know somebody behind a computer screen or even on a camera or over the phone. You have to get to know them over a period of time. It's not something you can just meet someone and fully diagnose them. Now, I know psychiatrists can sit somebody in a chair, ask them a few questions and say, oh, you have bipolar disorder, you have ADHD. What they're doing is they're going by patterns. That is what they're trained to do. I've seen these things before, these behaviors are familiar, and these are behaviors of such and such disorder. What people don't know is disorders, in order to be diagnosed with a disorder, obviously you have to have the traits of the disorder, a certain amount of the traits. Also, the way a disorder is determined is a bunch of people sit around a table and discuss the traits and things that they're seeing and they name it. Okay, so we're going to call this such and such. That's literally how these disorders ever came into being. Now, it's probably more sophisticated with computer technology and stuff like that. I don't know exactly how it works because I haven't worked behind the scenes in the psychology field, so I'm not sure how they do it. Probably some other people would be better at telling you that. But I do know that when it comes to BPD and other things, there are very common traits that you see over and over and over again in people that have these disorders. So it's not totally off to say, well, you know, we don't know what causes this. It's not totally off to say, we do know what causes it. Nobody knows, and yet everybody thinks they know. There's no one size fits all to everything, but there are common things that you'll see, like I just noted a minute ago, like the I hate you, don't leave me, the black and white thinking and all that stuff, that are very familiar with just about everybody that has BPD, and some people that have narcissistic personality disorder. And yes, there can be a crossover of many disorders. A person can have bipolar disorder and be BPD. They can have narcissistic personality disorder and have borderline traits, or vice versa. It's not uncommon, it's not unheard of to have crossover diagnoses or comorbid diagnoses. So anyways, I just wanted to share that little bit of information with you. I think this pretty much is going to conclude the BPD study that I've been doing, borderline personality disorder, in bite-sized pieces. And we'll go on to a different thing next time. I'm not sure what, but I'll be back with something. I don't know. Anyway, I hope y'all have a great day. Thanks for watching. And if you know anybody with these disorders that we're talking about, that I talk about on my channel in my videos, please see if you can seek some help for them. They deserve to have help. And if they're just truly toxic, well, guard your heart. Stay away from them. Just pretty much distance yourself. Because there are some people that you may not be the person that's best to reach out to them. You just have to determine that for yourself, and just be careful. Be very careful. So God bless you. Thanks for watching, and this concludes borderline personality disorder in bite-sized pieces. If I can help with anything, answer any questions, contact me at delusiondispeller@gmail.com. Thanks a lot for watching, and we'll see you next time.